Antiplatelet drugs, also known as anti-thrombotic drugs, prevent the formation of platelet-rich thrombus. They increase the bleeding time. Let us discuss the mechanism of action of the antiplatelet drugs. The first class of drugs is the thromboxane A2 synthesis inhibitors. The drug under this class is low-dose aspirin. Low-dose aspirin irreversibly inhibits the COX-1 enzyme present in the platelets. This leads to the reduced production of thromboxane A2 and inhibits platelet attachment. Platelets lacking a nucleus cannot synthesize new enzymes. So this antiplatelet effect lasts for the lifespan of the platelet, which is 7 to 10 days. The phosphodiesterase inhibitor like dipyridamole inhibits phosphodiesterase 3 PDE3 enzyme, which is responsible for the breakdown of cyclic adenosine monophosphate CAMP into AMP. So, by blocking this enzyme, intracellular levels of CAMP increases and ultimately inhibits platelet recruitment. Another class of antiplatelet drugs include the P2Y12 receptor antagonist. The irreversible blockers like ticlopidine, clopidogrel, prasugrel, and the reversible blockers like ticagrelor, cangrelor comes under this class. Ticlopidine, clopidogrel, and prasugrel are prodrugs and they irreversibly block the purinergic P2Y12 receptors present on the surface of the platelets. On the other hand, ticagrelor and cangrelor are active drugs and they reversibly blocks the P2Y12 receptors. Thus, they inhibit ADP-mediated platelet aggregation. The final class of antiplatelet drugs are the GP2B3A receptor inhibitors. Abscesimab, eptifibatide are examples for this class. They act by inhibiting the GP2B3A receptors present on the surface of the platelets. Fibrinogen normally cross-links these receptors, leading to platelet aggregation. Therefore, inhibition of these receptors prevents platelet aggregation. And these drugs are administered through IV route. Now, coming to the uses of antiplatelet drugs, aspirin is the drug of choice for myocardial infarction and stroke. It is also used as prophylaxis for coronary artery disease. Aspirin, in combination with other antiplatelet drugs, is used as dual antiplatelet therapy. Example: aspirin in combination with clopidogrel is given in acute coronary syndrome, which includes unstable angina, STEMI, and non-STEMI. Ticlopidine is given for prevention of stroke in patients with a history of transient ischemic attack. Dipyridamole in combination with warfarin is used for primary prophylaxis of thromboemboli in patients with prostatic heart valves. So that's a high-yield overview of the mechanism of action and uses of the antiplatelet drugs.